Hello, my name is Bernard Camins. I am an infectious diseases trained physician and currently am the medical director for infection prevention for the Mount Sinai Health System. The reason why everybody needs to wear a face covering is because it's the most effective way of slowing the spread of COVID-19. The main reason for why you need to wear a face covering is that in case you are do not have symptoms of COVID-19 or are in the pre-symptomatic phase, by covering your face or with a mask or a face covering is that you then prevent your respiratory droplets from spreading into the environment, thus thereby not contaminating or not infecting other people. For this particular situation, no. Any cloth mask, any face covering that can stop your respiratory droplets are fine. The surgical masks also do the same thing. Because of potentially shortages of surgical masks in the healthcare arena, we do recommend that everybody in public just wear any type of face covering. It depends on what situation you're in. And certainly when patients come for procedures to Mount Sinai facilities, we actually provide them with a surgical mask. But if you're out in public, anything that would make you more likely to wear them, meaning if it could be stylish, with some type of statement, as long as it's a cloth face covering, is probably not a bad idea, just to promote use of them. The only thing that I would recommend not to use are the cloth masks or any mask with a one-way valve, because even if you're breathing in, the air is filtered in. As you breathe out, the air is not filtered out. So if you're actually potentially infected with COVID-19, you could be breathing out respiratory droplets through that one-way valve and infecting other people. Again, while you are commuting or being out in public, you can wear any face covering that you have at home, as I mentioned before. But once you get into one of our facilities, we will provide you with a surgical mask. Unless you are caring for a patient with COVID-19 or a patient who is suspected of having COVID-19, the CDC and other public health agencies do not recommend wearing N95 masks. One particular reason is that it actually has to be fitted for you, or there is such a process called fit testing, where what we do in healthcare industry, where our healthcare workers are actually fit tested to make sure there are no leaks around the respirator, to make sure, and so that's part of what we do in the healthcare side. And so if you just buy a random N95, which you have not been fit tested for, there is a potential that there will be leaks, so they're no better than surgical masks. Yes, everybody who can tolerate a face covering should wear one. There are people who may have heart disease or congestive heart failure, or people with respiratory illnesses that prevents them from wearing a face covering. And of course, children younger than 2 may not be able to tolerate a face covering. Depending on the mask that you see, the only caution I would make is that if there are cloth face masks, then sure, why not, right? But I certainly would steer away from any mask with the valves, just for the same reason that I mentioned earlier. In this situation, no, I think for the reason why we need to wear a mask, which is to stop respiratory droplets from spreading if we are potentially infected, a face covering is equivalent to a surgical mask. But a surgical mask does have some advantage because they are made to be water repellent, so fluid repellent, which of course cloth masks are not. At least once a day, The recommendation is at the end of the day, after you've worn your face covering all day, is to take it off by just taking them off from the ear and not touching the front of it, and then washing them at the end of the day with soap and water. I think if you can afford or are able to make more than one face covering, then having a few would be advisable, so you can just all wash them at the same time and have one daily available. No, we prefer that you make sure that your cloth is face covering is dry when you put them on. One suggestion would be to iron them if it's made out of material that can be ironed. Well, first is that it's unlikely that children under 2 will be able to follow your instruction of keeping the face covering on. I think you should try your best to try to keep the mask on them. I think when people wear the mask, although not all the time, there's still some benefit of wearing them, at least especially in closed spaces when they're around other people. Otherwise, then just try to practice social distancing as much as possible. I think that you should require your kids' friends to wear masks during a play date. But I think the guidelines from the CDC are also pretty clear that if you're not from the same household, it's probably a good idea that you also practice social distancing, even during get-togethers. I have seen them. There are actually some face masks with cartoon characters or maybe animals or unicorns on them that may work for them. In fact, they may like to wear them. And again, the size also has to fit them as well. So smaller size masks are more appropriate for children, just because the mask does have to fit snugly over their nose and mouth. I think a mask or face covering is recommended when you're out in public. Now, if you're exercising and you are safely away from everybody, meaning you're more than 6 feet away, potentially in public, you might be able to take off that mask. But it's always advisable to keep your mask on just in case you are going to be close to somebody. But again, there are situations such as exercising where, and running or jogging where wearing a mask may be more difficult. But again, in that situation, I would then find a more secluded area to exercise in. And then at that point, maybe you can take off your mask. I think most public spaces will have rules about social distancing and also wearing face coverings. I would follow I think what I've heard of some recreational centers are doing is that when you walk into those places, you need to wear a face covering, but they can come off when you're in the pool. So that still means, though, you need to practice social distancing. And I think a lot of those places are also reducing the number of people that can come in by even as little as 25% capacity to allow for social distancing. Probably the only exception to that is if you're at a restaurant, right? I think most restaurants now will only allow outdoor seating, and they are spacing the tables far away from each other, so then that allows the person who's eating to take off their mask. Otherwise, for any other activity, the more you have your mask on, the more we're going to be able to control the outbreak. So even if you're out in public, again, you just don't know what instance you're going to be close to somebody else, that I think wearing your face covering is advisable. Unfortunately, when it comes to strangers, you may want to avoid getting into that situation. What I've advise everybody else to do, and I have done the same thing, that if I'm taking public transportation, rather than getting in an argument with somebody uh, for people to wear a mask, um, uh, I stay away from them. I keep my distance, recommend folding them. I would definitely keep them straight, but again, keep them wrapped in a plastic or a plastic container to protect them from getting soiled. Thank you very much for joining us today. I hope the information we provided you on face covering or mask is very informative and will help prevent the spread of COVID-19.